Good morning, everyone. Thanks for joining us. I woke up this morning hoping that I could say just the right thing to break in and be heard today in the noisiest of times on a very noisy day, I know. So here goes. We need to turn our attention local right now, or it's going to be a long, hungry winter in Minnesota. We've seen COVID-19 reverse a decade of gains in the hunger fight, leaving a record number of people battling through these tough times hungry. Communities of color have been especially hit hard, and worries will only intensify as winter sets in and grocery budgets shrink to nothing when non-negotiable expenses like internet for distance learning, heat, and medications come due. So nearly 6 months after we shared our initial COVID projections, on the relationship between COVID and hunger, we're back with an update on the need, troubling trends in who is hungry, and an ask for help putting strong fixes in place. We'll be hearing from a powerhouse team of partners and experts. Aileen Chernoff, the Senior Vice President of Community Development and the Center for Indian Country Development from our own Federal Reserve Bank here in Minneapolis. She's here. Good morning, Aileen. Amanda Hain, a research scientist from Wilder Research, whose work focuses on food insecurity and joins us. Good morning, Amanda. Thanks for being here. And Elena Zeal, Executive Director of the Kandiyohi County Food Shelf, one of our amazing agency partners, and she is rounding out today's panel. Good morning, Elena, and thanks for being here. Since COVID began, Second Harvest Heartland has delivered 30% more food to our food shelf partners, who have seen a 60% increase in the number of people served. Projections from McKinsey & Company suggest there's no end in sight, with this increase in hunger persisting through 2021. In response to the surging need, the hunger relief community has flexed again and again to deliver more food safely. Drive-through food shelves have become the norm, with some now offering online scheduling and call-ahead ordering so families can choose their groceries. Two-door food box deliveries help us keep those who are sick or homebound safe. And school meal programs are feeding kids and sometimes whole families while they're at home. Despite these smart adaptations, bigger changes are needed. We continue to see stark racial disparities in who experiences hunger. This means that Minnesotans of color, Black, Latinx, Asian, and Indigenous neighbors are at least twice as likely to live with hunger. Household pulse surveys put out by the U.S. Census Bureau suggests that this hunger divide is only growing. Unaddressed, this issue promises to deepen the impact of the pandemic and the disparities in our community. This news is deeply troubling to me, and it must be addressed if we have any chance of coming out of this pandemic a more connected and united community. While our eyes are on the long term, we must also make short-term progress. At Second Harvest Heartland, we're distributing culturally connected foods directly to communities of color, giving our produce business to farmers of color, and delivering more food assistance through staff members who are representative of the communities we serve. And we're going to keep going and learning along the way, hopefully with all of you. So I'd like to now turn it to Amanda, who can dive deeper into the latest hunger divide findings. Amanda, you have the mic. Thanks for being here.
Absolutely. And thank you, Allison. I really appreciate the opportunity to be here. As Allison mentioned, I'm from Wilder Research, and we've recently been looking at the emerging data on food insecurity, including who among our neighbors is being most impacted. I know we've all probably heard in the news and also from the great study that was commissioned by Second Harvest that we know that food insecurity is rising all around and is expected to continue to rise. For some folks, this is a new experience, but for others, the pandemic has really just added to the high levels of stress and financial uncertainty they were already facing. So as Allison mentioned, the US Census Bureau has been collecting data since the beginning of the pandemic in a weekly pulse survey to kind of get a snapshot of how we're doing, including around issues like food insecurity. And so Wilder's Minnesota Compass team has been analyzing the data for Minnesota. The numbers have really varied kind of week to week, but as of September 28th, about 35% of Minnesotans reported some degree of food insecurity. But not all Minnesotans are impacted equally, as Allison also mentioned. Specifically, as of the end of September, 68% of Latinx respondents reported some level of food insecurity, as well as 56% of Black respondents, 39% of Asian communities, 31% of white communities, and 69% of people identifying as other races or ethnicities, which in the census data also includes American Indian communities. I think we've especially seen in the last couple of weeks, but of course these groups are not monoliths and there are certainly variations within each of them, but anytime we see disparities like this, I think it's really critical that we also examine the policies and systems that underlie them. And so we can kind of take a step back and begin with the fact that these trends are not new in Minnesota. For example, even before the COVID pandemic, Black and American Indian Minnesotans were 6 times as likely as white residents to be enrolled in SNAP, also known as food stamps. And Latinx and Asian residents were about 3 times as likely to be enrolled in the program. Likewise, according to this Minnesota Student Survey in 2019, American Indian 8th graders were 3 times as likely as white students to report skipping meals in the last 30 days due to lack of money. And Black and Latinx 8th graders were twice as likely to do so. So then we can ask, what's causing food insecurity and why is the issue disproportionately impacting Black, Indigenous, and people of color or BIPOC communities in Minnesota? We do know that food insecurity is really impacted by a variety of factors, and food access or the availability of food in an area and how easy it is to get to does matter. But studies have consistently shown that, at least in the United States, the main driver of food insecurity is lack of money to afford food. So then we can kind of ask, so what's made it easier for white residents to have enough money to put food on the table and more difficult for BIPOC communities to do so? And for this, we can really look at to some of the long-lasting impacts of discriminatory policies that have created differences in opportunities for education, employment, homeownership, and wealth creation. There are, unfortunately, a number of examples, but I can highlight 2, including the fact that, in the first half of the 20th century, redlining and racial covenants prevented non-white Minnesotans from purchasing homes in specific neighborhoods, which made it harder for these communities to gain credit and build wealth. And that, of course, can also have implications for just your ability to afford higher education and access job opportunities. The policies also led to kind of increased segregation too between white and BIPOC communities, which promoted some further disinvestments. And then also welfare reform policies in the 1990s placed new immigration restrictions on who was eligible for SNAP, and undocumented folks have always been excluded from the program. And so we see some of the long-lasting impacts of these programs and the disparities in income and home ownership that we see today. So as of 2018, the average household income for white residents in Minnesota was about $71,000 compared to $48,000 for BIPOC communities. And we have some evidence that these disparities may be widening too. There's some early indications that Black workers have been disproportionately impacted by job losses from the pandemic. So then where do we go from here? It's clear that, actions are needed on multiple levels. There's action needed to address the immediate needs that we're seeing. And we're seeing some great investments from funders and state agencies to support food shelves and other hunger relief organizations. The federal government and Minnesota both stepped up to expand SNAP benefits, and SNAP is by far one of the most effective approaches for addressing food insecurity. And then, of course, the generosity of individuals donating to organizations is also, incredibly important. But at the same time, if we're going to truly confront the disparities that we're seeing, I think we'll need longer term solutions that address the economic inequities that are disproportionately affecting BIPOC communities. So policies that make it easier for families to be financially secure, Minneapolis's minimum wage ordinance and St. Paul's guaranteed income pilot may be promising first steps, but investments in affordable housing, education, job creation, and other areas are also key. And then a number of Minnesota cities are integrating language to improve access in their comp plans. And there's just a lot of great examples right now of local coalitions working to build more just and equitable food systems in their communities, both now and also pre-pandemic. So there is a lot of energy for this work. And I know I'm kind of short on time, so I'm gonna end it there, but we can certainly take questions at the end. I'll note too that Wilder Research has a recent blog post where this data is available, but you can also contact me if you need any sources for them.
Great. Thanks, Amanda. And we'll put that information in the chat in case anyone wants a link to it. Your team at Wilder continues to shed light on how we're showing up for one another. We appreciate you shining that light on food insecurity today with us. So thank you. Now I'd like to pass the mic to Aileen to share the economic forecast moving forward. How has COVID impacted the local economy, and what can we expect in the year to come? Aileen, thanks again for joining us.
Well, thanks, Allison, and thank you, Amanda, for that report out. My name is Aline Shurumoff, and I lead the Community Development and the Center for Indian Country Development at the Minneapolis Fed. And we're responsible for tracking and understanding how low and moderate income communities and Indian country are faring in general. And we've been kind of on hyperdrive because of COVID, and then after the killing of George Floyd as well, in the 9th District in particular, we've been really focused on community impacts. I would say it's safe to say that these last few months have been really difficult for communities in the 9th District as well as in Indian country. I think Amanda spent some time mentioning what was happening in Indian country, but I thought I'd just spend a couple of minutes doing a little bit of a deep dive into it, because I feel Native communities often don't show up in the data just in terms of population. So it's difficult to really have a sense of what's happening with our tribal communities across the country. So the Center for Indian Country Development at the Minneapolis Fed has also conducted a series of pulse surveys with tribal governments and tribally owned enterprises, as well as hosted meetings with tribal leaders and national organizations to try to assess the real-time economic impacts. And we know tribal governments are experiencing a kind of a double whammy of economic consequence due to the fact that tribes have limited tax base, in part by the effects of dual taxation from states and the inability for tribes to collect property taxes on trust lands. They depend heavily on dividends from the enterprises that they own, which is really kind of a unique model for government revenue generation in the United States. So not only did a majority of tribally owned enterprises close their doors in the spring, including 100% of gaming operations nationally, over 30% of enterprises saw an 80% reduction in revenue, resulting in a decline of revenue and dividends available to the tribes. So that's at the same time that tribal governments are really reporting an increase, a 90% increase in costs due to COVID. So what's at stake there is really the ability for tribal governments to provide essential government services to their citizens, like building roads, providing healthcare, things like that, in the time of increasing costs due to COVID. We also see unemployment. Native unemployment has always historically been higher than the rest of the nation, and that trend has continued through the pandemic. Pre-pandemic unemployment levels hovered around 7.5% in April. Around 7.5%, and in April, Native unemployment levels skyrocketed to about 26%, which was double white unemployment. So unemployment rates have fortunately gone down since April, but they're still hovering around 13%. And so over the last 6 months through August 2020, the unemployment rates were about 16.6% for Black workers and 6.6% for white workers. So you can see kind of disparate impacts from an unemployment standpoint, both in the Native community as well as with other communities of color. So that also impacts kind of tribal businesses and their ability to have enough kind of cash on hand to maintain operations beyond a 3-month horizon. We've also been looking at, outside of Indian country, sort of economic distress on organizations. So we've seen economic distress on individuals and households and families. We're also seeing to stress on service organizations that provide critical social services to those families in a time of need. And many of them, about a quarter, 27% in our August survey, were reporting that COVID-19 was significant to their organization, and they are expecting recovery to be very difficult. So I think it's difficult to predict exactly what will come in the months and the years ahead. And I think it really depends on the way in which we can bring the virus under control and the actions that are taken by policymakers to support people who have lost their jobs and to support people who are trying to cope with the impacts of COVID. But really, I think that that's ultimately going to be what helps us through this is the availability of additional assistance. I think we saw that the increased levels of unemployment insurance were actually very helpful to many families, especially on the lower end of the income scale. And having seen that those benefits kind of end in July, and Minnesota picking up a portion of a smaller increase from the $600 top up, we were calling it, to roughly $300. I think that's been very helpful to many families. I think we're starting to see concerns about what happens to with foreclosure moratoriums and eviction moratoriums. If those end, what will happen to kind of household security in the future? So we're really looking from the Fed's perspective at Congress to think about what other actions they can take to support people in this time. So I know we're short on time, so I'll pause there and see if there are other questions later. Thank you.
Thanks, Aileen. And really appreciate that information. We certainly saw those extra unemployment benefits benefit food insecure individuals across our state. So thanks for all you do. And now I'd like to turn it to Elena Zeal from the Kandiyohi County Food Shelf, whose team is working double time, I know, to respond to residents in Wilmer. Elena, we've heard about the impact on a broad scale, but let us give us a sense of what's happening on the ground in your area.
Thank you, Allison. As you said, my name is Alana Zeal. I'm the executive director here at the Kandiyohi County Food Shelf, which is in Wilmer, Minnesota. So it's about 2 hours west of the Twin Cities, to kind of get a perspective. March 16th, 2020 at 11 a.m. will always stand out in my mind for many years to come. That is the day and time where we actually closed the food shelf here in Kandiyohi County to people coming in for food. That day was a scramble, it was a blur. We tried different things and figured out how to get food out to people that are in need. And they were in great need during the first couple months of COVID. It was completely a zoo here. We are actually doing curbside pickup, which means when they get to the food shelf, they give us a call, and then we get their food out to them. We have prepackaged boxes of food that our volunteers inside are actually preparing prior to them coming. When they call us, we put in the dairy and frozen meat, and then we send it outside for them, and we physically put it into their vehicles, that food. So it's a no-touch delivery. We're doing this very short of volunteers. We have 3 staff here at the food shelf. Prior to COVID, we had about 60 volunteers, active volunteers. We are down to about 15. So you can imagine the hustle and bustle here at the food shelf when people call and need food and get things done here. We're still doing food rescue, which is going to the local grocery stores and getting food like from Cub, Cashwise, Quick Trip, that type of thing. We have scaled down the number of food rescue stores we are going to, simply because we don't have the volunteers to actually go to those stores to pick up those and bring the food back to the food shelf, to sort it here at the food shelf for bad expired food, and then get it out to the people that need it. So we're currently going to, we have 3 Quick Trips in town. So we're going to all 3 of them, and then we're picking up Epic Cub food. So we're still getting the fresh produce and deli items and stuff like that are very, very important to our clients going forward. And then going back to the ethnicities, we in Kandiyohi County have a big East African population as well as Hispanic population. The biggest barrier we're seeing with those is the language barrier. Outside of the food shelf, we have it written in all 3 languages to call us, our phone number and all that stuff. But some of those people don't understand what to do. So they will call us, and we know that the language barrier is there. So then one of us staff will go outside and try to actually write their name down and get the food out to them. Just how many people are in your house, that type of thing, and just get the food out to them. We've had probably every month since April, we've had a CFAP distribution event provided by Second Harvest, which is the COVID Food Assistance Program. So it's a drive-through event. It's usually for a couple hours on a certain day of the month where people just drive through. We put a box of food in their vehicle, milk, produce, that type of thing, no questions asked. At those events, we've been fortunate enough, a couple of the events, we've had community leaders from the East African community and Hispanic community come to those events so we could actually translate. They could tell them about the food shelf and all that stuff. So we've been blessed with that opportunity here at the food shelf as well. But I think here in rural Minnesota, it is the language barrier that is the hardest, and we're trying to work on that and get the word out. And we're very thankful we do have those community leaders that are going out to those communities and telling them about the story about the food shelf, that we're here for them and what they need to do to get the food. So, and then I guess I want to end it on, I need you guys to reach out to your local food shelves and your communities. Ask them if they need volunteers. They need donations of food or financial donations. I know here at the Kandiyohi County Food Shelf, we say cash is king here because we can buy so much more food through Second Harvest than you can with your $10 at the grocery store. We love food, don't get me wrong, but we can buy so much more through Second Harvest. So just urge you to contact your local food shelf and see what they need help with, if it's volunteers or financial donations. So appreciate your time.
Thanks, Elena. And we'll put the link to your food shelf in the chat so people can know if they are willing to donate. And like Elena said, cash is king, and I think so are volunteers. And I think food shelves are short on both right now, and whatever anyone can do is helpful. So thank you so much. And before we turn it to questions, maybe just one other comment. I'd like to encourage anyone who's on the line or watching us, if they need help, to reach out right away. Accepting help from your neighbors means you trust your community. And I always think that's a good sign of the strength of our community. It sets us up to make it through this crisis. So likewise, if you can afford to give a little help, we hope you do. It's going to take every one of us getting involved to either give or receive help to get through this. So thank you once again. We are here to help. I know our contact information will be in the chat. If anyone needs to find a local food shelf, we are here to assist. So thank you. And Elizabeth, I would guess we have some questions.
I do indeed. Thanks, Allison. So first question is for Amanda. This is from Jordan in Minneapolis. And he says, I want to understand why communities of color would be more hungry, but I'm not there yet. Health disparities are about years of unrelenting racism catching up with folks. Why would racism prevent food from being delivered everywhere it's needed? So Amanda, I feel like you touched on some answers to this, and I'd love to give you the floor to say more.
Yeah, I mean, I like to think about food insecurity in terms of both distance and income barriers, or those are kind of two sides of it. And certainly they both can kind of play off of each other in terms of the fact that, if you have enough money, you may have more options of whether food is available or affordable in your area, or you may be able to secure transportation to get to a wider variety of options. But when we've had kind of systemic policies in places for decades, as Jordan mentions, that can create, different opportunities to be able to afford food, or whether food is affordable. And we know that income, again, is kind of the main, or not income, but cost is sort of the main driver of food insecurity in the United States. And so that's, I think, why you kind of see some of those differences.
Right.
I wonder, Elizabeth, I can throw a real sharp example in here too. Amanda, thank you for that. And those are, you're talking about systemic and long-term issues that we all need to dive in on to fix. There's also a couple examples just from a few months ago here. And the areas that experienced such unrest after George Floyd's murder are particularly impacted. Those are communities of color, and they lost grocery stores, they lost pharmacies, all of that. That is another example that maybe helps Jordan kind of connect those dots. There's a lot of dots to connect, so thank you for answering the question, but we are still doing mass distributions in those areas. Because they are underserved. Those grocery stores are not back up and running. And those are, again, I'm talking about the shorter term end of that, Amanda. We're in it for the long haul for sure with you and others. But there's some stark examples of that in the last few months.
Absolutely. And just to share with everybody on the call, when we were sort of moving through our prep, we all talked to the panelists, and Allison and I talked about the fact that this is just the beginning of a complicated conversation this morning. So we very much hope that we keep talking about all of these complex issues. Next question is for you, Alana, from Kathy in Mankato. She says, it seems to me that rural communities of color are most at risk for hunger and face a real double whammy here. What can we all do to help spread the resources that are concentrated in the cities throughout the state?
Yeah, I think donating, finding your local food shelf, finding out what they need. And if you know someone in your rural community that maybe is bilingual, that type of thing, have them volunteer at the food shelf, or even go out to their communities and spread the word about what the food shelf does, how you access it, financial donations, that type of thing. Just be an activist for those people of ethnicity.
Thank you. So one final question. Nope, sorry, two more. One just popping in. Megan in St. Paul says, if each of you could make one change to deal with all of this, what would you do? And what should all of the individuals listening do? So you've got a magic wand. What's the one thing that each of you change? Allison, you want to start?
Yeah, and maybe because it's right in my face, I think it's really important to keep talking about all of this and face it head on. And that goes for, talking about food insecurity and if people need help so they know where to access it, and to strip the stigma away from asking for help. But I think the most important thing a lot of us can do is keep talking about these issues so they stay at the forefront, so we can find the best solutions as we move forward.
Great. Alana?
I also think being an advocate for those out there, we have a lot of people that come to the food shelf that are proxies, which means that they pick up for other people that can't get to the food shelf, they have no transportation, that type of thing. Just be an advocate for those that need us, whether it be, financially or food related.
Eileen?
So I think I still believe that there's an opportunity for Congress to act to provide additional support, fiscal support to Americans who have lost their jobs, who are really suffering in this time. So I think that maybe that's not a direct action for myself because I'm obviously not in Congress, but I think that that's something that we should continue to maintain some focus on. The one thing that we are doing at the Minneapolis Fed that really kind of relates to the systems and structures that we were talking about earlier is we've launched a series on exploring structural racism and its role in the economy and how racism manifests in society and economy. And we'll be diving into employment, housing, education, criminal justice over the next year, essentially, really trying to find policies and solutions to disrupt those systems. So those are things that we could maybe continue to think about. But I also just would say support your neighbor in this time. I think we're all in a really difficult moment, and it's important that we keep an eye out on each other, for each other.
Amanda?
Yeah, I would kind of echo everything that people have said. I would encourage folks to certainly reach out to your local food shelves, but also to not just do it now, but keep an eye on kind of the long-term need that we'll have. I know from the last Great Recession, I think it took a good 10 years before rates of food insecurity fully returned to the rates that they were beforehand. And so I think this need is going to continue, and we'll need long-term support. Advocating also for expansion of SNAP benefits. The government took a really great first step in doing that during the pandemic, and it would be great to do that long-term. And then I think also to Elaine's point too, just continuing to really look at food security through kind of a systems lens and how all these different factors kind of play into it. Housing impacts, you know, a family's ability to afford food, medical bills do, transportation, all of that is kind of in one sort of system that impacts individual families and individuals. So.
Fantastic.
Elizabeth, if I can say just one last thing.
Sure.
SNAP keeps coming up, and it's been mentioned a couple times, and it brings together a couple things people said. First of all, I think SNAP is the closest thing to a silver bullet we have to ending hunger. We have seen it in action this summer and how helpful it is. And so when we're talking about a federal stimulus package, it is really important that federal nutrition programs, including SNAP, are bolstered right now to help families. I think it helps the economy, it helps our neighbors, and it's, you know, in my opinion, a no-brainer in addition to that unemployment, those bonus payments. But we cannot underscore, and I think if anyone's listening, even if you don't know if you're eligible, call us or go to our website. We will help you figure it out. More people are eligible than they even think. And so we stand by this community and we're ready to help. But SNAP is so important right now. So I just wanted to underscore that.
Fantastic. All right, one last comment to share. It's actually kind of an assignment for the five of us. Peter in St. Joe's says, this seems like the perfect combination of people talking big picture data and policy and on the ground realities. Will you all keep talking to solve this big problem? So Peter, I agree with you. There's really good energy on the call this morning, and we will take that forward. I can assure you we do all really work together regularly, but maybe we need a monthly coffee clutch to keep all of this going.
I mean, this is the A team. We're all A's. We have some girl power. We can do this.
Absolutely.
All right.
All right, so it's gone too fast. Thank you so much for the conversation, panelists and folks who have attended. Really appreciate the time, and everybody be safe on those roads this afternoon. Thank you so much.
Thanks, everyone. Bye-bye.
Bye.